Most doctors don't fail during diagnosis. They fail during the physical exam language and communication in real exams and actual clinical practice. Today you'll learn how to ask permission like a native doctor, how to give safe, clear instructions, the 7 most dangerous mistakes doctors make during physical exams, and 3 bonus high-risk communication traps that will save your marks and your patients. This is essential for OET, PLAB, AMC, OSCE stations, and real hospital work abroad. If you touch a patient, your language matters. Part 1. Why physical exam language is high risk. Physical examination combines authority, politeness, safety, and consent. Examiners and patients are listening for clear instructions, respect for dignity, patient comfort, and professional tone. One wrong phrase can sound rude, unsafe, or legally risky. Effective exam communication is not taught enough. Even medical students struggle to phrase their actions clearly during clinical exams. Mistake number 1. Touching without permission. Wrong. I will examine you now. Cold, directive, command-like. Right. Is it okay if I examine your chest now? I'd like to examine your abdomen. Is that all right? Why this matters? Formal explicit consent is legally required for intimate or notable exams. Simply doing it because a patient is in a room is not enough. A skilled clinician must seek consent in clear language the patient can understand. Mistake number 2. Unclear instructions. Wrong. Breathe. Turn. Patients often freeze. They don't know what you mean. Right. Please take a deep breath in and then out slowly. Could you turn your body slightly to your left, please? Exam tip. Break tasks into smaller, actionable steps with clear verbs and expectations. Real-life tie-in. Miscommunication here can lead to poor data collection or missed findings, which studies show are a large contributor to delayed diagnosis and adverse outcomes. Mistake number 3. Not explaining what you're doing. Wrong. Silent exam. Right. I'm just going to listen to your heart now. You might feel some pressure. This increases patient anxiety, and clear verbal explanation builds trust and cooperation. Tip. Reveal the purpose of each step before you do it. Mistake number 4. Bad warning phrases. Wrong. This will hurt. Danger. Makes patient tense, nervous. Right. You may feel some discomfort. Please let me know if the pressure becomes painful. This uses softening language that feels professional and calm. Mistake number 5. Ignoring patient dignity. Wrong. Remove your clothes. Sounds directive and rude. Right. Please remove your shirt. I'll make sure you have privacy. Let me know if you'd like more time. Why this matters? Patient dignity and privacy are examiner scoring criteria and patient safety standards in real practice. Mistake number 6. Not checking comfort. Wrong. You proceed without confirming comfort. Right. Are you comfortable like this? Please let me know if you need to stop. This shows patient-centered care, not just task completion. Mistake number 7. Failure to close the exam professionally. Wrong. Stops and walks away. Right. That's the end of the examination. Thank you. You can get dressed now. Professional closure signals confidence and clarity. It avoids confusion for patients and boosts marks in exams. Perfect physical exam model. Use a communication template like this. 1. Is it okay if I examine you now? 2. I'll start with checking your blood pressure. 3. Please take a deep breath in and out slowly. 4. You may feel some pressure here. 5. Are you comfortable? 6. That's the end. Thank you. This model is safe, clear, and native-level medical English. Bonus mistake number 8. Using medical jargon with patients. Wrong. Your ECG shows ischemic changes. Right. Your heart tracing shows signs of reduced blood flow. Easy language without being oversimplified. This keeps patients informed and confident without confusion. Bonus mistake number 9. talking to the examiner instead of the patient. Many candidates fall into this trap in OSCE PLAB. They describe their actions to the examiner and ignore the patient. Right. Speak to the patient while doing the exam. I'm listening to your lungs now. Exam tip. Examiners want to hear your language directed at the patient, not a dry narration to them. Bonus mistake number 10. Ignoring patient emotional cues. Wrong. Patient says, "I'm nervous," and you ignore it. Right. I hear you. It's normal to be nervous. I'll explain each step before I do it. Addressing emotions keeps patients calmer and participating in the exam. If you're serious about working abroad as a doctor, mastering medical English in physical exams is not optional, it's a core skill. Subscribe for more medical English. Comment below, which part of physical examination language worries you most? Follow for more medical English Pro.